Local Sky 3, the biggest views from where you live.
It's fitting, I should think, that as we come off the cusp of celebrating the moms out there for Mother's Day, that this week is dedicated to women's health. That can cover lots of different topics and conversations. Dr. Chelsea Ryan joins us this morning with CHI Memorial's Integrative Medicine Associates, and her topic of choice today is mammograms. Good to see you this morning.
Good morning, good to see you.
So I think a lot of people hearing that that's your topic of choice might think, okay, isn't that typically more for an October conversation? But I guess the truth is, as a primary care doctor, you're constantly reminding your patients about the importance of this.
Yeah, we talk every annual wellness visit with the appropriate patient about all their types of screening, so including breast cancer screening. So we try to use that annual wellness visit just to kind of hit the mark. So whether it's in October or whether it's now, we try to just talk to them and have shared decision making about what might be the best appropriate screening for them.
Where do we stand? Do you know, to throw a statistic possibly your way, how many women are getting their mammograms at all, much less when they really should?
Ooh, I don't know that one, but what I can tell you, because I wrote down a few notes this morning in preparation for this, and I do have a couple, not number statistics, but breast cancer is the most frequent type of non-skin cancer and most frequent cause of cancer death in women worldwide. And then I also have that it is the second most frequent cause of cancer death in U.S. women, and that mammography both reduces the odds of dying of breast cancer and facilitates the use of early treatment. So those are some pretty good facts. I don't have numbers for you, but I think when we're talking about this, just kind of relaying how important it is to at least talk to your doctor about.
I threw you a total curveball, and I didn't expect you to have the actual numbers, but I do know that you're seeing women come in and out of your office on a very regular basis. And so has it reached a point where it's not even a surprise to you if a woman who's 50 says, oh, I've never had a mammogram before?
It's usually 50, yes, but not unheard of. So a lot of, there's different groups that make recommendations for when you start breast cancer screening. And so at age 40, we at least raise the topic of discussing risks and benefits and having shared decision making. So between 40 and 49, we talk about screening every 1 to 2 years. But instead of a recommendation, we call it raising the discussion topic to see kind of their fears, or even to discuss family history and things like that. So that's kind of where we start. And then 50 to 74 recommend breast cancer screening every 1 to 2 years. So there's a little bit of a difference there. Yeah. I would say most often we are starting mammograms around 40, but it's like I said, it's basically talking it out, seeing how the patient feels about it.
I would think that it's actually a much easier conversation to have now, because obviously the research has shown that early intervention can be very effective if there is a breast cancer diagnosis. So I would think most women are quick to say, yeah, let's get me signed up.
Yeah, and there are, and then there's other, with everything in primary care or any medical decision, our job is not to tell you what you have to do. Our job is to kind of sit there and give you the information and learn about the person and what their fears might be about this and why they may not want something like this, because every person is different, and what might be right for someone might not be right for another. And so you're right, where the benefits of mammography is you're reducing your risk of dying from breast cancer because of early intervention. But we're going to touch today a little bit also on the other sides of things, because we need to talk about both the benefits and possible harms of any screening, because for the most part they all have that. And so as primary care, we should talk about both of them. And so one of the harms or the risks of mammography is overdiagnosis. So there are certain breast cancers that may not ever affect the patient's life, depending on how old they are or how severe the breast cancer is. However, right now we have no way of really predicting, looking at mammography as, oh my gosh, this cancer will hurt someone in a year versus in 12 years, or whatever. So we can't differentiate that, but that is something we have to bring up with the patient, is that you may get treatment or biopsies that could lead to other complications, and this cancer may never affect you, but we can't tell which ones will. Some other things we talk about are false positives. So you could have a mammogram and they could see something on there that would lead to further imaging or biopsies, and then an infection or anxiety from that. And so we always talk to people about that. And then there is always a chance of a false negative. So nothing is perfect. And so there can be some cancers that are not readily seen on mammography yet. And so, that's why we encourage repeated screening and follow-up. And then a lot of people have some fear about radiation, and that's the one that comes up the most when people don't want to do that done, or pain is the other one. But for radiation, I actually looked this up because I needed something to kind of like talk to patients about, because that was a fear for them. And on the American Cancer Society website, they said that the amount of radiation from a mammogram is about 7 weeks of natural surrounding radiation. So we are exposed to radiation every day.
Wow.
And so it's just what we call natural surroundings. And so the amount of radiation from a mammogram is about 7 weeks of background radiation.
Well, I'm glad that you were able to go through all of those, and I'm sorry that I had you get to them as late as you did, but I think it's interesting to watch you see how you not only do your research, but that you do it because as the primary care doctor, you're wanting to inform your patient in a holistic way for them to be able to make the decision that's right for her.
Yeah, maybe not so much holistic, but just as, I think that we just need to tell people the facts and
right.
then well educate them. And if they decide that, hey, this isn't for me, or for a lot of the times it's does the benefits outweigh the risks for a certain screening, for a certain lab test, for a certain
right.
Certain medicine. And so if we decide together that the benefits of whatever we're doing outweigh the risks, there's never no risk, right? But as long as those benefits outweigh the risk, then they feel more comfortable kind of moving forward. And they can always change their mind, research, have questions, things like that.
Well, there are the facts of how people can get in touch with you. They just saw it. She is taking new patients. If you want to give her a call, her office on Taft Highway up on Signal Mountain. CHI Memorial Integrative Medicine Associates. Chelsea, thank you so much.
It's nice to see you.
Also, before we run, I think we have time for our dad joke of the week this morning. As you know, our good friend Jason Wright, who's a co-worker of ours here at the station, is kind of a funny guy. So he's begun heading over to the Memorial Auditorium to tell sometimes a bomb, sometimes a hit dad joke of the week. Here's